facial appearance and identity are profoundly connected. Most people recognize you by your face. Your nose is the central, most prominent feature of your face, and when it's out of balance with other facial features, it can greatly influence your appearance and your identity. Rhinoplasty is a surgical procedure that can improve the function and appearance of the nose. It is performed to meet aesthetic goals or for reconstructive purposes to correct trauma, birth defects, or breathing problems. Aspects of surgery that are not cosmetic may be covered by insurance. A detailed examination by a physician verifying the cause of the impairment is necessary to gain authorization from an insurer. This presentation will give you a general overview of rhinoplasty. It is not a substitute for a complete consultation with a qualified surgeon. A complete consultation will include the discussion of your goals and expectations for the procedure. You should have a clear idea of what bothers you about your nose and your appearance. Your surgeon will evaluate your specific situation, suggest a recommended course of treatment, and discuss likely outcomes, as well as any potential risks and complications. Any questions and concerns should be addressed during the consultation. Full disclosure of your health history is important to your safety. This includes any history of medical conditions or illnesses in your family, your current use of any medications, vitamins, herbal supplements, as well as any alcohol, tobacco, or drug use. Regardless of the reason for rhinoplasty, surgery of the nose is usually performed when facial growth is complete. Generally, this is by age 15. Good candidates for rhinoplasty are healthy individuals with no life-threatening illnesses that can impair healing. A positive outlook and reasonable expectations are also important. Patients who smoke are at increased risk of poor healing. They are advised to stop smoking for several weeks before and after surgery. Combining rhinoplasty with other procedures, such as chin augmentation, can enhance aesthetic results. Whether aesthetic or reconstructive, the result is usually an improved self-image and greater confidence. Additional procedures can increase the duration and complexity of the surgery and should be carefully considered and discussed with your surgeon. Prior to your procedure, you will be asked to sign informed consent documents. These are used to make sure you fully understand the procedure, including any risks and complications, and that you commit to following any and all instructions you are given. These include pre-surgical considerations, day of surgery instructions, and information related to the use of anesthesia. Each rhinoplasty procedure is highly individualized. No two noses are exactly alike. Rhinoplasty may enhance or reduce the size and width of the nose by reducing visible humps or filling depressions, and may improve symmetry. When the nasal tip is enlarged, bulbous, droopy, upturned, or hooked, rhinoplasty can improve its proportions and structure. Large or wide nostrils can be reduced, and rhinoplasty can improve the relationship between the nose and upper lip. There are two approaches to the nose: a closed procedure, where incisions are hidden in the nostrils, or an open procedure, where an additional incision is made across the columella. These incisions give access to the nasal structures. The nose can be sculpted to the desired shape by reducing or reshaping bone, cartilage, and soft tissue. Cartilage, grafted from other areas of the body, or synthetic materials, may be used to build up nasal structures. Additional incisions will be placed in the natural creases of the nostrils when nostril size is altered. To improve the angle between the base of the nose and the upper lip, an incision at the columella may be necessary. Once the reshaping is complete, the skin is redraped and the incisions are closed. The nose is covered in surgical tape to help maintain its new shape, and a metal splint is designed, cut, shaped, and fit over the nose. Nasal packing may be necessary, but will be removed within the first week. The procedure is complete. The dressing must remain in place for 1 week or longer and should not be removed without specific instructions by your surgeon. Bruising, swelling, and soreness are all common side effects with rhinoplasty. Any discomfort or pain you feel can be controlled with medication or cold compresses. Bruising can be covered with cosmetics. As with any surgery, possible complications may arise. These include nosebleeds, infection, and risks related to the use of anesthesia. Healing will take from 4 to 6 weeks as swelling resolves and the shape of the nose refines and settles. Sometimes the healing process is not fully predictable, and results do not match the goals or expectations that were set. A secondary, less extensive procedure may become necessary. Proper and diligent sun protection during the next 6 months will help prevent pigment irregularities. Special care should be taken to avoid injury to the nose during physical activity. The final results of rhinoplasty will take a minimum of 1 year to be realized. Results are generally considered permanent, but aging and possible movement of cartilage can cause changes over time. Whether subtle or dramatic, cosmetic or reconstructive, rhinoplasty is the means to helping achieve the look, the identity, and the confidence you deserve.